The National Council of Provinces has voted in favour of the National Health Insurance Bill. 8 of the 9 provinces have approved the bill, with only the Western Cape voting against it. The NHI system is expected to be implemented in stages once President Cyril Ramaphosa has approved it. However, healthcare organisations, business and the opposition have all strongly opposed it. They've urged the President not to sign the bill into law and refer it back to Parliament for reconsideration. Government says NHI is designed to use pooled funds to provide access to quality, affordable personal health services for all South Africans based on their health needs, irrespective of socio-economic status. However, it requires raising an additional 200 billion rand in taxes, and business says South Africa does not have the resources.
Well, let's get some reaction with Dr. Katlego Mothudi, who is the Board of Healthcare Funders of South Africa's Managing Director. Good evening to you and welcome. Noble aims, a practical nightmare, but advocates of NHI say this will spark a radical shift to health access equity, that it will actually stimulate efficiencies and improve healthcare quality across the board. But I know you were concerned, your organization was, about a few issues going in as this developed. Where do you stand now as this bill is approved and possibly one click away from being signed into law?
Good evening, Iman, and thanks for having us. We are deeply concerned because I think a lot of hours has been spent trying to assist government to craft a bill that would truly increase access to healthcare services. As it stands now, we believe that the bill is deeply flawed and there are many areas of uncertainty. In your introduction, you spoke about the funding that is required to keep it afloat. And the perception is that you are going to pool funds. But in reality, the funds that are there now are divided into two. I think people often talk about the two-tier system. The one component comes from private funding, largely from medical aid schemes. Those are voluntary funds. For you then to have a similar kind of financial provision, you'd have to raise those taxes. And that, whatever 200 odd billion rand that comes from medical schemes is not easily transferable. So it makes it difficult to see it working from that point of view. There are other areas of concern that we're looking at, whether from a governance perspective where the Minister of Health is given a lot of powers. I mean, there are some provisions in the clause that indicate that he can actually have an impact or override other laws by implementing or introducing regulations. Those are just some of the concerns that have been raised, and we are concerned that they haven't been looked at to try and craft a better bill.
And as you say, we're hearing tonight, what we're hearing from you, these concerns they aren't new. You've expressed them along the journey. You've expressed them as this has progressed from one level to the next. Given that you aren't alone in these concerns, the South African Medical Association and others also have their concerns about this. What do you think the impact of that resistance, your resistance, is going to have on the functionality of the NHI, given that one would say it's a foregone conclusion. Of course, the President still has to sign that, but it seems like, it's pretty much there.
From a funding perspective, Iman, the bill proposes that medical schemes be relocated to a complementary function. What it means is that all the services that are what is termed essential healthcare services can only be procured through the fund, and then by extension with the contracting of service providers. So if there's no buy-in from the private sector, we would have to wonder about the appetite for facilities that are in the private sector as well as the healthcare practitioners to actually partner with the fund. The second issue around procurement of services. Government does not have unlimited resources. With the current budget, we often see during the second or third quarter of the government's financial year, a lot of healthcare facilities in the public sector not being able to provide the necessary services. You hear about the long waiting periods for essential surgery. Some services in some of the provinces, for example, oncology, have been almost non-existent for a number of years. So you do need partnership and true partnership with the private sector to make sure that we are able to broaden the healthcare services that are needed by the population.
Yeah, but given where we are now, how are we going to get that true partnership that you're talking about? In my first question, I mentioned that one of the aspirations were that by being in this sort of configuration with public and private healthcare in the country, there would be this kind of contagion effect of efficiencies that will spill over from the private into the public sector. What you're talking about, a true partnership, that seems like it's going to be elusive given, as I say, this, that you're diametrically opposed to where this bill is in its content and in its form right now. How are we going to get there?
Yeah, so the bill does write out potential of partnerships. If you look at certain provisions of this, of the proposed bill, Section 33 specifically is what we speak about, is that the funding from medical schemes will only be limited to complementary care. And if you read carefully what that means, it would be maybe discretionary healthcare services or what people would call cosmetic services. It means that the buying power of the medical schemes would actually shrink. Now, if you look at how much government spends on healthcare services, currently it's very little. The current budget of about 260 billion rand, a lot of it goes towards the provinces, and the vast majority of the funds are then paid towards salaries. You then have challenges of medical legal cases that drain the money from the provinces, as well as accruals for unpaid services the previous year. So there's actually very little money that can immediately be made available for healthcare services. And that's why I said that the access will actually be diminished even for those people in the public sector.
In just in 20 seconds or so, what is your next move? It's very concerning what you're saying, given the advanced stage of where we are now, and it's been through a couple of iterations. We are here. What are you going to do next?
So the next step is for the president to consider the bill, and we've been assured that he doesn't just rubber stamp, and we hope that that is possible. Many organizations, including ourselves, have actually made representations to his office in terms of lobbying him to either send it back to the National Assembly, or if he's got the similar concerns like we do around the constitutionality, send it straight to the Constitutional Court to actually get a ruling on it. I think that would give us comfort that some of our comments have actually been taken seriously, and we are of the view that they would actually find in the favor of those who are concerned.
So it's not over?
It's not over. Definitely the issue of judicial review is something that is looming, and all this is done in the interest of healthcare services expansion to all South Africans.
Thank you for your time. We appreciate it. Dr. Katlego Mothudi, who is the MD of the Board of Healthcare Funders of South Africa. And that forms our marquee question tonight. The National Council of Provinces passing the National Health Insurance Bill, and we have been asking for your views. Let's share them now.